individuals really want to do something good and want to contribute to something good and make a difference in people's lives. And when we're able to really share with them either something that we're engaged in or just by our own example, the enthusiasm we have for the good that's being accomplished in OSF, and that matches with the passion of our patient or our families, then it gives them that wonderful bridge and opportunity to be a part of the good that we provide. And to me, that's the gold heart of philanthropy.
What we try to do here is focus on the donor, what they want. We will ask the question, what would you like to accomplish with your money that's meaningful to you? And then try to marry it with the priorities of this organization. So it's a tremendous win-win. And it's really a spiritual experience, when that happens.
I mean, it just kind of grabbed you, and it grabbed us, and it kind of gave us this feeling like, hey, we want to be part of this. To be able to have that comfort, the warmth, the peacefulness, the dignity. I just think it continues the sister's mission, all the way to the end.
Sometimes we don't remember that if families really moved by the care that they got, they want to give back. They want to acknowledge that and be able to give back. And that can be done in a bunch of different ways. And I think we just need to remain open to that so that if that's just being perhaps on a committee or being part of a focus group to give their input on how their experience was and things that can be improved, or if that's partnering with us to develop a new program or some new aspect of the hospital, most families really want to give back and want to help in a way that is appropriate for them. So if we just keep in our mind that it's important for them to be able to help us because we help them, I think it makes it a lot easier for physicians to work with the foundation and to say, hey, this is a family where maybe building a relationship would be important because they want to give back in some way.
Not just the health needs, but really all of their needs, and what are they feeling? How can we support that? What resources do we need to bring in to support that? And from there, philanthropy becomes easy because now you have a grateful patient. Outcomes are one thing, and we need those. I mean, we have to have good outcomes, but sometimes even more importantly is how did the patient and the family feel about their experience here at OSF? Those that have positive experiences, whether or not they had a good outcome, are the ones who end up supporting the organization for the future.
For the people that don't know our story with OSF, that story happened June 22nd, 1983. Our first son, Jacob, was to be born. The doctor came in and said, you're probably not going to have a son. It's not going to work. And to the grace of the staff there and to people above, we had a healthy boy, but that was our first stint with OSF. But at that time, I was making $4.25 an hour, and I went in to pay my bill or to see what I could do to pay my bill, and the sister came out and she goes, "You don't owe us anything." I was raised to know that, I couldn't take care of it then, but I was driven to make sure that someday down the road that I could do something about that.
The real heart of philanthropy will be that, like blurring the lines and the distances between and really partnering and becoming one with our communities and those we have the gift and privilege to care for, that they can be walking side by side with us, helping to assess their needs, helping us to creatively meet those needs, and then letting us know how well we're doing. Then they truly are driving a benefit and a value for our communities, and I know God would bless that good work. So we look to them even more in the future as we seek to design to truly meet their needs together with them.